Welcome to the RX Physiotherapy podcast, your go-to destination for all things physio, rehab, health and wellness. I'm April Patterson.
And I'm Brendan Jason.
And each week, we will dive deep into fascinating topics within the health world. From physiotherapy to nutrition and beyond, we cover it all. So sit back, relax, and enjoy the journey as we explore the exciting world of health and wellness.
And before we begin, we'd like to acknowledge the traditional owners of the land which we meet today, the Dharawal people, and pay respect to elders past, present, and emerging.
Let's get started.
We were both talking about how, without tooting your own horn, that episode 1 went off with almost no hitches, no glitches, nothing, which we did not expect. Maybe that's because we don't believe in ourselves enough, or whether we fluked it and this one's going to be quite bad.
Stay tuned.
So for the 3 or 4 people listening, this could be quite hilarious. And along that same note, I wanted to surprise April that we've already got our first sponsor. No, I'm just kidding. No. Alright, so episode 1, we covered the who's, ands, or whats of hypermobility. And hopefully that was already very informative for a lot of people. Today we're going over the kind of techniques that you like to use, because you're definitely more experienced and more an expert in this, but also the stuff that I've used in the past as well. Mm-hmm. We're going to cover how we seek pain relief for patients. Yeah. We never promise full pain relief for everyone, because that would be sadly unrealistic. Although some people do reach that level as well. We look around at exercise concepts, and then we're also going to cover a lot about when you should either modify how much training you're doing, or when you should just take time off, because one key point I picked up from last time was how much people with hypermobility run with a high level of stress hormone in their system. Yeah. So they're already above that kind of normal level. Yeah. And then you add on more of that. Even though exercise is good for us, it's still a version of stress. That could be enough to tip them over the point.
Yeah, exactly.
Fair enough.
Very true.
Is there anything else you wanted to add from last time that you thought, oh, I should have hit this a little bit better, or that should have been, what am I trying to say here? Yeah, anything that you just felt like you left out that you wanted to make a stronger point with, or no?
I guess the main thing that comes to mind is that every person with hypermobility is different. So you've got to go for the symptoms of that individual versus what is generally known. So someone with hypermobility might not have any musculoskeletal issues or like GI issues, but majority do have, musculoskeletal issues.
And I'm assuming those people that aren't symptomatic in either realm, musculoskeletal or gastrointestinal, they kind of go through life essentially thinking, oh, I'm just a bit more bendy than the next person. Yeah. Which, when you think about it, could be a lot of people.
It's a lot of people. So up to 20% of the population can qualify for hypermobility.
Wow.
Yeah. So it's like 1 in 5. It's just whether it starts to impact on your quality of life, or if you have symptoms that are in line with any of the things that we spoke about in the last podcast.
Fair enough.
Yeah.
Okay, that's really good. Let's dive into pain, which is everyone's favourite part. What kind of, say someone comes to the clinic and they've had chronic pain for a long time in a certain joint, what kind of strategies are you doing quickly to like get that early relief and to allow things to function just a little bit better, and just get them to know that, hey, there's still hope. There's still stuff that I can do and our therapists can do to help us?
Yeah, that's a good question. So depending on what joint they're struggling with, I will teach them different strategies to essentially achieve what we call pain gating, which is where you cause the stimulus coming from that area that the brain is interpreting as pain to lower. So therefore the messages of pain aren't getting to the brain as strongly, and therefore the individual will experience less pain. So this isn't fixing the underlying problem, but it's helping that individual to be able to cope with the intensity of the pain that they're experiencing. One of the main things is eliminating tasks that are too much for that person for where they're at. I've had people be bed bound. I've had people who just need to reduce how much walking they're doing while they're strengthening. It's such a big continuum. But yeah, it would depend on reducing the things that are triggering the pain and giving the patient strategies to reduce the pain intensity when it does come on. And then the biggest part is the education. So getting them to understand what's causing the pain, that pain isn't always directly related to damage as well. So they would be the three aspects I would come from.
Fair enough.
Yeah.
Could you give us, because we're going to dive into this a little bit later as well,
Yeah.
what's an example of that pain gain theory? Because we know, and this may be a little bit different for some people to understand, we may do a video explaining it, and like we'll get the big whiteboard out and whatnot.
Yeah.
Because pain is never coming from the actual source of where it shows up. Our brain is telling us that this area is in pain. Or if you go to an even further level, that this area is in danger, quote unquote. There are no such things as pain signals, which was big for me. When I went to uni as well, I thought this is completely different to what we grew up with.
Yep.
What kind of treatments do you use to kind of close that gate, as it were? Or I like to always think of it as turning down the volume a little bit.
Yeah. So this could look like massage. So say when an area of the body feels like it's under threat, what it will do is it will reduce the threshold in which the body needs input in order to send a signal to the brain that that area is potentially threatened. So instead of needing someone to punch you in the arm, it could just be a light touch, and that could give you pain.
Okay.
Because the body has become extra vigilant as a strategy for survival. When you massage the joint or you do dry needling or cupping, you're giving the body another stimulus, which is, if you want to think about it, interrupting the intensity of that that pathway to the brain that's getting information about the structure and making a decision as to whether give pain or not. So it's getting a less strong signal from the mechanoreceptors, which are the little receptors that detect force in the area, and then it's going, okay, it's been turned down, this area is in less threat, and then the pain will be reduced as well.
Which is a crazy mechanism when you really think about it. And it's awesome that because originally, I don't know how you felt when you first finished uni.
Yeah.
I definitely believed that when I was working through someone's tissues or mobilizing a joint, that it was physically just moving things, and that's what was causing the change.
Yes.
And that is a small part of it. Of course, you're never going to get away from that. But
yeah,
I want to say like 95% of it is this altering of the sensation.
Exactly.
And that's what allows things to function better and get people out of pain and get people moving better.
Exactly.
It's just wild when you think about it. And same again, if we didn't go through uni and go through this education as well, it's silly that this kind of information still isn't that easy to access.
Yeah, definitely.
And hopefully people listening are like, oh, we can go down the rabbit hole here, and it can be quite a rabbit hole.
Yes.
So be prepared. But it is worth knowing, because it definitely did change the perception I had with my own kind of chronic niggling injuries. I'm sure you did as well.
Yeah, exactly. So because the body's main goal is survival in that moment, so it has short-term thinking, if there's like a potential overuse in that area, if you're experiencing a 10 out of 10 pain, it doesn't mean that you've got a 10 out of 10 injury. It could just be the body is like, let's give a lot of pain so this person self-limits and has time to rest while we decide whether...
What's the best port of call here?
Exactly.
Yeah. I think that's a really good way of putting it, and similar to how I try to explain it to patients who come in with like a back spasm.
Yeah.
That it's rare, especially if they have no red flags. Say they come in with just lower back pain, nothing referred down the legs, no numbness, pins and needles, no problems going to the bathroom. Very rarely would there be anything structurally wrong with their back. But for whatever reason, their body's decided the back is unsafe right now, let us lock you the heck down.
Yep.
And I find explaining that is actually quite relieving in a lot of ways for people, because it takes away that danger.
That's right.
And say, oh, this hurts, but I also know it's going to settle, and this sticks in my head of a patient, without giving away too much, who was convinced they would end up in a wheelchair. And that sadly happens a lot. A lot of people jump to that conclusion, or they've had the wrong information from the wrong person.
Yeah.
When in reality, 2 weeks later, that person was discharged with no pain.
Yeah.
So it can be so simple for certain people. That's a special advice.
Yeah. No, it's a very good point. So yeah, it's educating the person that the pain they're experiencing isn't proportionate to damage of the same intensity. Showing them how to reduce the intensity of the pain that they're feeling, giving them the education as to why they have multiple things going on. And then you need to find the exercise that is appropriate for them.
At that time.
Exactly. And that could be, for someone who's bedbound, getting them in a pool where you eliminate gravity.
Yeah, absolutely.
So,
which is a great option if it's available to you. You see dramatic results for those people, that's for sure.
Exactly. And exercise with hypermobility is a long game.
Mm-hmm.
My mum's actually a really good example of this. So she got to the point where she was nearly bedbound, and it took us about 2 years to get her back to the point where she was pretty much free to move as she liked without much pain. But again, she was given the wrong information and had no idea that she was hypermobile. So she would get an injury and just self-limit because her body saw that as pain.
Yeah,
pain equals stop moving.
For those wondering what that noise is, that's our coffee machine going in the background, which gets a regular workout.
It's true, we love coffee.
Mm-hmm.
We just love it.
Cool little segue there.
Yeah.
Because you already started talking about exercise, which was literally our next point.
Yeah.
And we want to delve into the concepts of what we tend to lean on. And this goes into the blog that we've got, and we're going to literally after this go do some exercise clips of examples, because these concepts are fairly easy to understand, but they are quite different from joint to joint as well.
Yeah.
But there's also ways to play around with it. And of course, if you're one of our patients, we're the ones who are going to be directing you in the right area and steering you clear of certain things too.
Yeah.
So why don't we start with first concept, supported versus unsupported exercises. Why are they so good, and what are some examples?
So supported exercises are great for that person who is so weak in that particular joint that they can't stabilize their body and isolate the joint at the same time. So you get a lot of compensation.
Just too much going on at once.
Exactly.
Yeah.
So this might look like doing the squat but holding on to a bar versus doing the squat without any assistance.
Yep.
But then life is quote unquote unstable. Like you don't have a mobility aid. Well, most likely not. So therefore, you need to be able to deal with the effects of gravity and just the changing directions. Like it's quite common that we have to bend over and pick something off the ground and then stand back up again and reach up and grab something off the shelf. So you need to be strong in all these different ranges. But if you go straight to something complex like that and the joints don't have the capacity for it, you're just going to cause that body to go into that protection mode, and then that individual will experience pain, which can, especially if they're not educated around pain, can be really scary for them and can make them want to avoid exercise altogether. And therefore, the thing that is essentially going to build capacity to stop them being in pain is the thing that they're avoiding.
Which is a hard line, that's for sure.
Exactly.
And that's a really good example, like just a bodyweight squat versus what's called a Hatfield squat, where you're hanging onto something. That's as simple as it could be.
Yeah.
I think some more things that I've used, step ups while holding onto a railing. A lot of times just literally having your upper body doing some work changes it completely for a lot of people. Another thing that always rings true is the Pilates reformer can be an absolute godsend for these people, because you're most of the time lying on your back in a closed chain, or where your legs are always pushing against something. So there's always that inherent stability, and balance is nowhere near as much of an issue for these people.
Yeah.
Awesome. What about neutral positions versus I don't want to say extreme range of motion, but maybe put this simpler. Close to our body versus far away from our body.
So if you imagine holding a weight further away from your body, it's a lot harder and you have a lot less capacity. So you do want to start exercises close to the body, but then again in life, you need to be able to reach out and grab something. So you need to make it functional for what that person needs to do, whilst keeping in mind where they're at. So again, if they are really struggling to pick up their child that weighs 5 kilos and they're doing it with a bent arm, you're not
tiny child.
Yeah, until I don't have kids.
Maybe they're dash arms.
I was going to say, I think my dash arms weigh 5 kilos. You're not going to get them doing like a straight arm 5 kilo lift.
At least not. That would be the goal.
Exactly, yeah.
And I feel like that's probably a general rule of thumb for most people for any injury, is that the closer you are to your midline of your spine, generally that's where our body's the most stable.
Yeah.
But a lot of people take this too far and they often get fearful of those far out positions.
Exactly.
Which, like you said, we need to have those for day-to-day life in our ADL sports as well.
Yeah.
I don't think there is a sport where you stand with your feet perfectly together and your arms directly to your side. Except diving.
And it's gravity eliminated too.
Yeah, but then there's so much impact. Anyway.
Yeah.
Side note. Isometric, which means without movement, versus isotonic, which is with movement.
So isometric is a good place to start to get that muscle activating, because you can do it again in a position that is the easiest for it to fire, which is close to the body and in the mid-range of the muscle. So if you think about like if your arm's super outstretched versus super close up, you aren't going to have as much strength in those ranges as if your arm was like in the middle and you're about to do a bicep curl. But then again, we need to have capacity to do the other sort of movements as well too, because day-to-day life requires them.
Of course.
So you want to start with isometrics if that person is at that level, and then you might want to move to, we call it eccentric, which is essentially where your body is going with gravity but your body's controlling it down against gravity. And then concentric is where you're bringing the muscle up against gravity, making it the hardest of the exercises. Yeah, so you want to build it up like that.
These will make more sense with the videos as well. I'm sure the conceptual things out there are like, yep, I understand you 100%.
Yeah.
Where the visual people may be a little bit lost, which is fair enough, but stick in there because it'll definitely make sense the second time around, that's for sure.
Yeah.
I think one of the obvious ones that I've got down here is increasing your range of motion slowly.
Yeah.
And that's same for everyone. If you feel stable in one position, it doesn't mean you automatically gain the rest of your range straight away. Especially, say, if someone's dislocated their shoulder multiple times and you've only just got some stability in there, it's not, I don't want to say dangerous, but it would be unwise to push those like overhead limits straight away or that T position.
Yeah.
The saying that I often use with patients is that we learn to own the new position.
Yeah.
Because there is, I think it's 15 degrees in and outside of any position that we do have control with. I don't know if you've heard that before, but say if you do, we keep coming back to this bicep curl or bicep hold, if you were to hold your arm at 90, we know you're also building strength 10 degrees above it and 10 degrees below it as well.
I've heard that, yeah. Yes.
Which is cool because it just means you've got a window that you can work with.
Yeah.
And then that window can overlap and overlap and overlap.
Yep.
Isn't the body crazy?
The body is crazy.
How about respecting joint integrity, which I put down from what I noticed as, same again, if someone's come in and they've just dislocated their kneecap or popped their shoulder for the second or third time, and if they've been cleared of any breaks or tears, that is not the time to do any kind of high range of motion or high velocity stuff. No. That's the time to stiffen up, lock them down, keep muscles firing as best we can. Yeah. But that's the time to let things settle.
Let the tissues stiffen up around it. Yeah, definitely.
Massive.
Yeah.
And the thing I always hear from certain patients is, no pain, no gain. And I told them, for you, probably not the best rule.
Definitely true.
Especially in those early stages.
Yep.
Effective gravity was one that you brought up that really resonated well with me. And the example I put in the blog was an exercise for neck strength that we often do is just chin tucks off the floor. For some people, that can be very intense, especially if they're more longer in the cervical vertebrae or neck, and they haven't trained their neck before. That can be a lot of effort and can give headaches. Whereas a simple addition would be to sit upright while doing it and just pushing your hand against your head. Same again, we'll show that example as well.
Yeah.
Are there any other examples that you have that you find are affected by gravity that you need to play with for certain patients?
Yeah, I would say for all the joints, especially the neck tends to be one that I see a lot of weakness in. So we all expect to be able to have our head up against gravity, but for someone with hypermobility, with not a lot of capacity, that's actually a lot of work. The head can weigh up to 8 kilos, and you're essentially trying to stabilize it on top of your body. So you need a lot of strength. Shoulder is another one that is really affected by gravity in terms of the position. So it's a most mobile joint. You can get your hand, in a
Complete 360.
Yeah, I was going to say complete 360. So you're going to feel the greatest amount of gravity through that as well. Gravity can be a great tool for us to manipulate the intensity of an exercise. So say if someone squatting, it's too much because they've got to essentially control their body weight to slowly lower themselves down, controlled with gravity, and then push up against gravity. If that's too much, we could just get them to hold on to something and do a slow, just the down phase of the squat, because they're not having to push up against gravity at the top. So we can use gravity to make things harder or easier.
Fair enough.
Yeah.
Okay. We discussed this yesterday, the idea of exercise snacks.
Yeah.
I guess the easiest way of putting this one is, for most people, doing a whole session is within their capacity.
Yeah.
For someone who's hypermobile, and especially who's already dealing with like the effect of chronic fatigue as well.
Yes.
Doing little spurts throughout the day is so much more manageable.
It is.
If it's possible. It's not always going to be possible for everyone, but if it's an option, it makes a hell of a lot more sense, even if it's just in the early stages of your training, because your body can just cope better with it. And I know you do it pretty often as well.
Yeah. I have the benefit of working at a gym.
It helps.
So if I have 5 exercises to get done that day, I might do them in 5 different blocks. So I might see like a few clients, do an exercise or 2, a few clients, have lunch, do another few, when I finish, do a few. I find that is really effective because your body just gets time to rest and recover. And I find that I end up with more capacity to lift heavier weights because of that, which then builds my overall capacity higher.
Which makes sense. You're taking like a 30 to 90 minute rest break between exercise sometimes.
Exactly.
Which would be ideal. And then your cortisol is not spiking nearly as high, and it's much more lower throughout the day.
Exactly.
If I've been trying to implement it, but it is hard because I think personality type comes into it as well.
Yeah.
Where I like to train and I'll be in there for like an hour and a half to 2 hours. Some people are going to freak out for me saying 2 hours because they think, the cortisol is going to be massively spiked. Probably.
Yeah.
It's also going to be spiked from how much coffee we drink too.
Oh, that's so true.
But if it is an option, definitely at least try it. It's not going to hurt you by any means either.
Yeah. Definitely.
Last thing I want to talk about is some general rules of thumb for when it's a good idea to either reduce your training volume, reduce your training frequency, or just to flat out have a day off, which I think everyone should listen to. Because the quote that always sticks in my head from a powerlifter and bodybuilder from the States called Stan Efferding, he said, if you get up at 4 a.m. in the morning after like 5 hours sleep and you go straight to the gym and you're proud of that, he said you're stepping over $100 bills to collect pennies. Just exemplifying how important sleep is to everyone.
Yeah.
And that's something that, I don't know if you ask your patients about it, I ask them about it all the time.
Yeah, definitely.
And it often precedes either a minor injury or a really big injury as well.
Yeah.
And I think there was a statistic from a EP colleague of mine, shout out Matt Mears, that during the HSC, student athletes are 40% more likely to get injured. I think that's huge.
Wow.
And it's the same again, that's the time to when you should take a break from training, maybe go for a walk, get out some sun.
Yeah.
And don't risk it. But we all know, especially those teenage athletes are absolute guns, some of them, and would rather die than take a day off completely.
Definitely. More is not always better.
God,
and
no.
sometimes more is worse.
Yes.
Yeah.
It'd be such an easy thing for us to just... If recovery wasn't a huge component of training, everyone would be excellent.
Yeah.
Where I find like a lot of people can really smash training and even do quite well with their diet. But it's the sleep, and it's the rest days, and it's the bringing your stress level down that everyone really struggles with. But people are getting better with the saunas, the cold plunges.
Yeah.
More and more people are making use of meditation and mindfulness stuff.
Yeah.
We're going in the right direction, but still it's not great.
Yeah.
So with that long intro, if you got poor sleep, generally, like I said, decreased volume, decreased training frequency, or just rest.
Yeah.
I know there are some studies that it's more effective, like say you missed 3 hours sleep the night before, instead of trying to catch up on 3 hours sleep that night, it's more effective to do an hour extra for the next 3 days.
Yeah.
Do you know the science behind that, or you just heard it as well? I would assume it'd just be around that circadian rhythm, not just dumping on essentially another 30% of downtime.
I think it's, yeah. So when we sleep, our brain detoxifies all of the like metabolic waste from all the chemical reactions it requires in order to operate, which is like billions and billions of processes a day.
Yes.
So that's an interesting question. I wonder if it's that because you've missed that sleep, your body's overall inflamed and it takes a few days for it to reduce, and therefore it's better to have more sleep for 3 days versus one big sleep, which might reduce it, but then you've got 2 more days where your body's trying to bring down the inflammation.
Yeah,
I don't know.
fair enough. Maybe there's a staggered effect. We'd have to go down that rabbit hole.
Yeah.
That can be another podcast.
Haha.
What about poor diet?
Well, I think everyone knows that diet is very important in building muscle and recovery.
Mm-hmm.
When it comes to fat loss, and muscle building, it's more important than the parameters of your training.
Oh god, yeah.
Yeah.
Yeah, if you don't have that locked in, it doesn't matter what you're training.
It's like trying to build a house without material, essentially. Your body needs the right material in order to create the right structures. And a good example is I had a client who was a vegetarian and was not eating enough protein.
Mm-hmm.
She was going to the gym 5 days a week and she had like muscle pain throughout her entire body. She was constantly fatigued, and it's because she was ripping her muscles, and in her body, that's what the body does. It like gets little micro tears so that it can make the muscle bigger. But if you don't have the building blocks to build more muscle, then your body is just inflamed, and it's
constantly in that state.
It's actually breaking down muscle instead of building it.
She would have just thought, I'll just train hard. Yeah. It's a slippery slope, isn't it? That's for sure.
Exactly. So nutrition is huge.
And I tell a lot of patients as well, say if they're midway stay through rehab for whatever it is, and they've got like a family function on the weekend, I say, if you're going to have lots of salty foods or have a couple of drinks, just know it probably will feel a bit worse next day. Yeah. Because especially high sugar and alcohol is always going to make you more sensitive to pain, also dehydrate you a little bit, and just straight up increase the amount of inflammation in your body as well.
Exactly.
It's not going to cause any damage, but in the short term, it will just kind of I like to warn people. Yeah. Because you don't want to make people feel like rehab has to own their entire life. Yeah. It's okay to break free just from like a diet or a training cycle. It's alright to have a day off or two and just relax. To balance. Just know that the rent's due the next day.
That's true.
And some people bounce back quick, which definitely seems to be age more than anything. I don't know about you, but when I was much younger, hangovers, I don't drink anymore, thank God. Hangovers seem to be non-existent. Yeah. And then you'd hit a very quick age where you'd be like, oh God, I need to go to sleep for 3 days. But then again, we all know people who seem to shrug them off like crazy, which, anyway, I think there's a genetic component to that too.
Yeah, very true.
The last one, which is a bit of a hot topic at the moment as well, I've heard other people talk about this as well, is when your menstrual cycle starts.
Yeah.
What kind of advice would you have for the ladies out there around training?
Yeah, so the day you get your period is when you're going to be your strongest and your performance is going to be most similar to a male.
Right.
The week leading up to, well, let's call it the 3 days before ovulation, you will also feel quite good as well. And then that week before your period, your progesterone levels skyrocket, and that's your body wanting to rest. So if you push yourself in that time, your body is going to release cortisol at a much higher rate, and you're actually not going to be able to adapt to the exercise effectively. That's just going to cause burnout. And that's, yeah. So for someone who has a normal cycle, and I would recommend that you take that into account. And it is individual for everyone.
Of course, I'm assuming there's going to be a lot of
nuances.
play,
Yeah,
it could change from month to month, year to year, quite drastically for some too.
exactly. And this is where women are quite like complex, because people want to put you, people want to put you on these like 6-week strength like programs,
not taking that into account.
Exactly, because we know, well, what the research has shown is it takes like on average 6 weeks to see some muscle strength changes. But for women, like 10 days of their cycle, they're not building muscle like men.
No.
So you can't have the same parameters, and you need to listen to your body, because if your body is exhausted and you push through it, you're not going to build the muscle you think you will, and you'll end up so exhausted that when the week comes around that you're going to be at your best, when you've just had your period, you're going to be really tired. So,
which is a bit of a cruel joke, in a way.
Yeah.
So that's the week to really slow things down and like go to like low impact, low weight. Think of like it could be your deload week.
Yeah, and you don't feel guilty about it.
Of course,
that's the thing. Not you're being lazy. You're got a different body requirement to a male, which most of the studies are done on in terms of muscle building.
Crazy.
Yeah.
Not only that, we know that the actual collagen fibers change more as well. So the risk of injury is, I don't know about the stat, I'm assuming it'd be higher than 40% as well. We'd have to double check that. It's just a risky time, I guess. And then for those living with hypermobility,
yes,
imagine that's just astronomical for them as well.
Exactly.
Okay.
So it's complex.
Yeah. And on that note, is there anything you'd want to add? Because like I said, we're going to go film some action scenes.
If you have hypermobility, just don't compare yourself to anyone else, because you need a specific set of parameters that are targeted to you, and you're not being lazy by not doing what everyone else is doing, especially while you're still in the phase of building capacity. You would actually be doing your body a disservice by trying to push through and go to the gym 6 days a week and do what everyone else does. You will just burn out and get injured. So you need to take a methodical approach to it, guided by a healthcare practitioner, and you need to play the long game with it, because it can unfortunately take a few years to see some real significant changes in some individuals. Some individuals you can see it in a few months, but I always try to get people to frame it like this is a journey, and you love yourself and you love your body, and every day you're making deposits into being a better and better version of yourself. That's a really cool way of looking at it. Yeah. And that point makes a lot of sense about, we always talk about how you should never compare yourself to anyone, because comparing someone who's hypermobile versus someone who's not hypermobile, I don't want to say we're different species. We're still both humans, but far different requirements for both. That's right, exactly. And you will come across people who, through a lack of education, will push you and think it comes, and make you feel like you're being a whinger. But you just got to be strong. We'll find the right people that understand and listen to your body, and fair enough. Take it day by day.
Awesome.
Yeah.
Alrighty, ready for your quick 60?
Yes.
Alright, so 6 questions. Last time I think went off really cool and I learned a lot about your favourite animal. So today, remember, no thinking, just whatever comes to your head, blurt it out.
Yep.
Alright, ready?
Yep.
3, 2, 1. Favourite movie?
Pretty Woman.
Least favourite movie?
I can't remember what it was called. Oh.
We'll come back to it.
Yep.
Favourite actor? This is going great, April.
I don't know any names of actors. Julia Roberts.
Okay. Favourite TV show?
Maybe Archer. Rick and Morty. Rick
yeah,
and Morty or
Rick
Archer.
and Morty. Okay.
Yeah.
Least favourite TV show?
Friends.
Fair enough. We lost all 5 listeners then. And last one, favourite documentary?
The one on Elon Musk.
Oh, what's that called?
I don't know, something about Elon Musk.
Okay. Shows how much I pay attention. Alright, I think that wraps it up for episode 2 of the RX Physiotherapy podcast. I'd like to thank everyone for listening. April, thanks again.
Thank you.
We're going to have to get a light when it's time for you to talk without a question. Alright everyone, tune in next week. I think we're going to continue to delve down this path and we're going to go into diagnoses.
Yeah.
And that kind of, which can be a bit rough for some people, but if, same again, the right people on your side can make things a little more streamlined.
Definitely.
Awesome. Alright, tune in next week guys. Have a good week. See you, bye.